I am Cheung, a medical doctor. This is a short video on palpating for trigger points for knees. Palpating for common trigger points in the knee region. Trigger points are tender, palpable nodules or cords in a muscle or a ligament, which, when compressed, are very tender and can give rise to referred pain. There are more than 20 muscles and ligaments attached to the knee area. Trigger points in these can cause knee pain, mimicking other knee conditions. Trigger points are very common in any pain syndromes. They can be the sole or part of the causes of the pain. It is very useful to eradicate them in any pain syndromes. Trigger points in the knee can be caused by 1. Trauma. For example, a fall, a jarring twist, a misstep. 2. Repetitive strain. For example, poor walking dynamics from a persistent plantar heel pain or being overweight. 3. Constant contraction or activation of a muscle in order to guard and protect a nearby painful structure. For example, constant contraction of the gracilis muscle to protect a minor arthritic knee pain. The position to palpate for trigger points in the knee region. This is the right knee, the patella, the greater trochanter, the anterior superior iliac spine, the anterior inferior iliac spine, the pubis. A quick inspection first. Any effusion, any redness, any muscle wasting. At the junction between the patella and the patellar ligament is the knee joint line. And on either side are the collateral ligaments. We can palpate for trigger points along here. I like to use some soluble bath oil or massage oil when I palpate to increase the sensitivity. And on my palpating hand, I like to have my 4 fingertips in line for better coverage, like that. First, the quadriceps, the biggest muscle in the body. The rectus femoris, arising from the anterior inferior iliac spine down to the patella. And we can palpate for trigger point right along it, firmly. Trigger point can be anywhere along the length of the muscle, but interestingly, the pain is often felt at either end of its attachment. The vastus medialis, arising from the femur down to the patella. The vastus lateralis, the sartorius, arising from the anterior superior iliac spine down to the tibia, in the right knee at 5 o'clock to the patella, marked here in orange. The sartorius is the longest muscle in the body. We can palpate for trigger points all along it to here, like so. The gracilis, arising from the pubis to the tibia at a point just medial to the sartorius attachment, marked here. Trigger points in the gracilis are very common. It's usually found about 1/3 of its length from the knee. Interestingly, even though the trigger point, the tender trigger point is here, the pain is often experienced here. often mimicking other knee joint conditions. On the lateral aspects of the thigh, we have the tensor fasciae lata, a little bit anterior and above the greater trochanter. And on the lateral aspect of the thigh, we have the iliotibial band, a very thick ligamentous structure all along here to be attached to a point just medial to the fibular head. The attachment site is marked orange here. And we can palpate for trigger points along the iliotibial band. It is very common to find trigger points along here. And again, interestingly, is often at the lower third of the length of it. Trigger points here can often cause lateral knee pain. Now, with our palpating fingers on the back of the thigh, we can palpate for trigger points of the hamstring. On the lateral aspects, we have the bicep femoris and attach itself to the fibular head. On the medial aspect, we have the semitendinosus and the semimembranosus. The semitendinosus is attached to a point just medial to the gracilis attachment, marked here. Whereas the semimembranosus is attached to the medial aspects of the tibia. So these are very thick muscles. We have to palpate quite firmly to detect the trigger points. And then in the back of the knee, we have the plantaris and the popliteus. Trigger points in these can cause posterior knee pain. And then coming down, we have the gastrocnemius muscles. And below the bellies of the gastrocnemius muscles, we have the soleus muscle. The soleus muscle. Trigger points in the soleus are quite common, and they can cause plantar heel pain. This is a schematic diagram of all the common trigger points in the knee region. We should consider including trigger point palpation in our examination protocol. With practice, it can be done in a few minutes. Having found the trigger points in the patient that may be causing the pain, there are many modalities of treatment for them. Personally, I have found YNSA, Yamamoto New Scalp Acupuncture, to be highly effective. The treatment using YNSA can be viewed in another video.